Antimicrobials are therapeutic substances used to prevent or treat infections. They include antiseptics, antibiotics, antivirals, antifungals, and antiparasitics. Disinfectants are antimicrobial agents applied to non-living surfaces. Antibiotics. Antibiotics are mainly active against bacteria, but can also have activity against, for example, some parasites. They do not cure infections caused by viruses. Classification. Antibacterial agents can be classified into 5 groups: type of action, source, spectrum of activity, chemical structure, and function. Classification based on type of action. Generally, antibacterials can be classified on the basis of type of action: bacteriostatic and bactericidal. Antibacterials, which destroy bacteria by targeting the cell wall or cell membrane of the bacteria, are termed bactericidal, and those that slow or inhibit the growth of bacteria are referred to as bacteriostatic. Classification based on spectrum of activity. This is another way of classification of antibiotics or antibacterial agents, which is based on their target specification. In this category, the antibacterials may be either narrow or broad spectrum. The narrow-spectrum antibacterials are considered to be those which can work on a narrow range of microorganisms, that is, they act against gram-positive only or gram-negative only bacteria. Unlike narrow-spectrum antibacterial, the broad-spectrum antibacterial affects a wide range of pathogenic bacteria, including both gram-positive and gram-negative bacteria. Usually, the narrow-spectrum antibacterials are considered ideal antibacterials and are preferred over the broad-spectrum antibacterials. The reason is that the narrow-spectrum antibiotics do not kill as many of the normal microorganisms in the body as the broad-spectrum antibiotics, and thus has less ability to cause superinfection. Also, the narrow-spectrum antibiotic will cause less resistance of the bacteria as it will deal with only specific bacteria. Classification based on chemical structure. Different skeleton-containing antibiotics display different therapeutic behavior. Therefore, it is an ultimate need to classify antibacterials on the basis of their chemical structure. This classification is also very important as similar structural units have similar patterns of toxicity, effectiveness, and other related properties. Antibacterials can be classified into beta-lactams. Beta-lactam or beta-lactamase inhibitor combinations, aminoglycoside, macrolides, quinolones, and fluoroquinolones. Classification on the basis of mechanism of action. Function means how a drug works or what is its mode of action. This is one of the most important factors related to each antibacterial. The major processes or functions, which are responsible for bacterial growth, are cell wall synthesis, cell membrane function, protein synthesis, nucleic acid synthesis, and so on. All such processes are targets for antibiotics. Therefore, antibacterials, which interfere or disturb these processes in different ways, such as cell wall synthesis inhibitors, inhibitors of membrane function, inhibitors of protein synthesis, and inhibitors of nucleic acid synthesis. Antimicrobial resistance. Antimicrobial resistance occurs when bacteria, viruses, fungi, and parasites no longer respond to antimicrobial medicines. As a result of drug resistance, antibiotics and other antimicrobial medicines become ineffective and infections become difficult or impossible to treat, increasing the risk of disease spread, severe illness, disability, and death. Antimicrobial resistance is a natural process that happens over time through genetic changes in pathogens. Its emergence and spread is accelerated by human activity, mainly the misuse and overuse of antimicrobials to treat, prevent, or control infections in humans, animals, and plants.